my name's Allison. I'll be your student nurse today. Can I get your name and birthday, please? Okay, great. So I've double checked that with his wristband and that matches what I need. So today, sir, I will be accessing your port. So I'll be flushing it. And first I am going to wipe down my table, which I will have all my items. Okay, so we're gonna let that dry for a moment. Okay. Let's see here. So what I need to do first is palpate your port. And I don't see any redness. I'm not seeing any drainage. Is there any pain at the site? No? Okay, great. Okay. All right. Okay, so I am feeling for the, well, and depending on what kind of port they have, they might have the triangle. This one's feeling pretty circular here. Okay, and that's, so now I know where it is. Wash my hands again. And next I am going to prepare, well, first I'm going to grab my flush. Okay, I'm going to get any air pockets out from it. Got that. Okay, I'm going to prime my cuber needle here. Okay. Alright, so I'm just going to put my flush right on there. And I'm not touching anything, so I'm keeping it sterile here. Okay, making sure my clamp is open, which it is. Okay, I'm going to, alright, that's flushed. So now that can remain in there. I'm going to put that down there. And I've got my my package, my tray. Everything I need is in there. I've checked the expiration date, so we're all good to go. Okay, open this. Got my bio patch. I'm going to take out my package. Okay, so in it, first we've got a mask. So it should have a mask for the patient, and then sometimes also they'll include two, one for the patient and one for you. And this is for infection control, since this person is immunocompromised. And then we also have our sterile gloves. Okay, so first I want to open my package here. Put it over there. Okay. Let's see here. My alcohol pads there. Oh, let's see here. Oh, and I want to open up my bio patch. I want to stand far away here. And what we want to do, because we want to maintain sterility, flip it on there. Okay. And get my sterile gloves on here. Okay. Pick up. Do my non-dominant hand first. Stand back. Again, maintaining sterility. Okay. Okay, we've got our gloves on. So now we are all sterile, so we're good to go. Okay, so we want to look at what we have here. We've got our ChlorPrep, we've got our Tegaderm. So the first thing I want to do, I want to get my ChlorPrep, I want to break it. Oof. Okay, and then watching the clock, we are going to clean that site for 30 seconds. Okay, so we're going to go up and down using friction. Friction is key. Okay, and we're going to go back and forth. We're going to use concentric motion, going from inside out. Okay. Okay, that's been 30 seconds. So we can toss that. Okay, next. Okay, so now using my non-dominant, I'm gonna get that out of the package eventually. Okay. Okay, and grab my needle. Okay. Change my, okay. Then I'm going to remove the cover of the needle. So that's been drying for 30 seconds. So I'm going to remove my cover. I'm just going to stick that right there. Okay. All right. We want to go right in the center of where we found it. Okay. So we're going to push that in. And then initially, first we want to aspirate for a blood return. Okay. This little guy is not giving me a blood return right now. Actually, got a little bit. Okay. Now, if I didn't get a blood return, what I would want to have the patient do, cough, kind of move around a little bit. And of course, check your clamp to make sure that's not closed. And if it still didn't get a blood return, then I would notify the healthcare provider. But I am getting a blood return, so I'm going to go ahead and flush that entire 10 milliliter syringe. Okay. All right. Unclamp that. Get my alcohol. And of course, we're going to close our clamp. Get your alcohol. Clean for 15 seconds using the clock. And you could also use you could use a little scrub hub. I'm using an alcohol pad here. Okay. All right, that's been 15 seconds. And then you also want to grab your bio patch, blue to the sky. Kind of tough to get in there. But you put your bio patch on, and then you would do your shirt and pants, which are not included in our kit. And you would, of course, make sure that the patient is okay. Remove your gloves, perform hand hygiene again, and you would document the placement, how much you flushed, patient's reaction, if anything went wrong, and there you go.